In recent months, the US government has imposed high tariffs on Indian imports, first 25% and later as high as 50%. And now President Trump announced that starting October 1st, 2025, the US will impose 100% import duties on branded or patented pharmaceutical products. These measures were intended to balance trade and pressure India over its oil purchases from Russia. But here's the problem. India is one of the largest suppliers of generic medicines, pharmaceutical ingredients, and medical supplies to the US. The effects of tariff increases are felt by hospitals and patients here. Let's break this down. First, drug prices. India provides a significant portion of America's generic medicines. The cost of everything from antibiotics to chronic disease drugs is increasing with tariffs, putting more pressure on pharmacies and hospitals. Second, medical devices. Disposable supplies and diagnostic tools are imported in large amounts. Tariffs mean costly, extended waits, and in some cases, shortages. Third, supply chains. US hospitals already run on low inventories. Delays at customs and tariff risk are making it harder to maintain continuous supplies. And finally, budget strain. Hospitals are facing higher costs, insurance companies may increase premiums, and ultimately, patients could pay a higher amount. This isn't just about economics, it's about access to care. Experts in India claim that the US healthcare system will suffer more than India itself. Why? Because while India can shift exports to other countries, the US doesn't have quick option for economical medicines. Meanwhile, US healthcare organizations are urging Washington to relieve critical medical imports from tariffs, warning that patient care could be risked. So what's being done? Some medicines may soon be relieved from tariffs. Pharma companies are exploring at alternative supply chains and even expand US manufacturing. And yes, both governments are resuming negotiations, trying to reach a deal before the healthcare impact gets worse. The bottom line, this trade war is not restricted to economics or geopolitics. It is closely connected to America's healthcare system, which includes our hospitals, pharmacies, and patients. The longer it extends, the more everyday Americans could end up paying the price.